Hello, my name is Donald Price, and today I'll be presenting my research on midfoot pressure analysis in individuals with flat feet during stair climbing. This was conducted as a Polygence research project and later published in the American Journal of Student Research. Flat feet is a common condition that affects both youth and adults and can significantly reduce mobility and quality of life. In a normal foot, the medial longitudinal arch, the inner curve that runs from the heel to the ball of the foot, supports the body's weight and helps absorb impact during walking and running. In individuals with flat feet, this arch collapses downwards when standing or walking. In simpler terms, imagine the inside curve of the foot flattening out so the sole makes more contact with the ground. This structural change alters how the foot strikes the ground, which can cause changes in gait, reduced push-off power, and pain, not only in the foot but also in the knees and hips. Common treatments include physical therapy, which strengthens weak foot muscles and stretches tight tissues, and orthotics, which provide corrective support and improve foot alignment. The focus of my study is on how midfoot pressure differs between individuals with flat feet and those with normal feet while stair climbing. My initial hypothesis was that people with flat feet would show higher pressure on the medial longitudinal arch, since the collapse of this arch should direct more weight inward. I chose to investigate stair climbing specifically because while walking and running have been studied extensively, there's very little research on stair ascent. As stair climbing is one of the most common daily activities, requiring both balance and increased biomechanical effort compared to walking on level ground. For individuals with flat feet, understanding how pressure is redistributed during stair climbing is especially important because it reveals how the condition impacts everyday mobility beyond just flat surfaces. This knowledge can help clarify the broader ways flat feet affects gait and inform more effective treatments for patients. The study involved two male patients, one with clinically diagnosed bilateral flat feet for over 5 years and one with normal feet. Because this was a pilot study, the small sample size allowed me to test whether my pressure sensing system could detect clear differences between foot types. Both participants met strict inclusion criteria. Neither had undergone surgery on the lower body, and neither had recent injuries that might alter gait mechanics. Their body mass indexes were below 32, which reduced the influence of weight on pressure measurements. And additionally, neither had other musculoskeletal disorders, helping ensure that differences in foot structure were the primary factor influencing results. By controlling these criteria, I was able to focus the comparison directly on flat versus normal feet, generating preliminary data that could guide future studies with larger participant groups. To collect pressure data, I designed a system using four force-sensitive resistors, or FSRs. These sensors were thin and flexible, each about 2.5 centimeters in diameter, and were small enough to fit inside a shoe without disrupting movement. I placed two sensors along the medial longitudinal arch and two along the lateral arch of the right shoe, allowing me to capture differences in pressure between the inner and outer sides of the midfoot. The sensors were connected to an Arduino Uno board, which relayed data to a computer in real time. Before testing, the FSRs had to be calibrated to ensure accuracy. I applied known weights and newtons and recorded the corresponding analog readings from each sensor. By graphing these values, I was able to generate a calibration curve that converted raw analog signals into actual force measurements. This calibration step was essential for translating the sensor outputs into reliable pressure data. After calibration, each participant was fitted with a pressure sensing system. The four FSRs were embedded into the right shoe, and the Arduino Uno board was secured comfortably to the leg using a therapeutic band. Both participants wore the same model of shoe, a Nike Air Force One Low, to ensure consistency in fit and conditions. The system was designed to be lightweight and unobtrusive so it did not interfere with natural movement. Participants were then asked to ascend a set of stairs at a relaxed, natural pace. They were instructed not to alter their walking style so the data would reflect typical stair climbing rather than a forced gait. While the participants climbed, the system collected force data from each sensor simultaneously. The sampling rate was 33 Hz, meaning 33 readings per second, with less than a millisecond response time. This provided detailed high-resolution data for analyzing pressure distribution during stair ascent. Here I'm showing the normalized force graphs from one of the sensors, comparing the flat feet participant to the normal feet participant. I processed the data and created these graphs using Jupyter. Because the two participants climbed stairs at slightly different step rates, I scaled the time for the normal feet data by a factor of 1.23. This way their steps line up on the same timeline and can be compared directly. Each line represents a force measured by that sensor over several steps. What is shown is how the pressure patterns unfold across the step cycle for both foot types. This gives us a clear picture of how the forces differed when climbing stairs, which I'll interpret more fully in the discussion section. Shown here are the mean force values for each of the four sensors along with the independent t-test results. Sensors 1, 2, and 3 all show statistically significant differences between the flat and normal feet participants, with p-values below 0.05. Sensor 4 did not demonstrate a significant difference. These results indicate that the largest differences occurred along the medial and lateral longitudinal arches closer to the midfoot, while the more distal lateral sensor remained similar between groups. On the right is a graph of the average force over one representative step. This was calculated by averaging across 13 steps of the flat feet participant and 20 steps of the normal feet participant. The graph provides a clear visualization of the overall pressure profile during stair climbing, showing how the two foot types differ across the step cycle. My original hypothesis predicted that flat feet would create higher pressure along the medial longitudinal arch. The data, however, showed the opposite pattern. Instead of a greater loading on the medial arch, the flat feet participant demonstrated a clear shift of pressure toward the lateral arch. This indicates that flat feet change how forces are distributed during stair climbing. A likely explanation of this shift outward acts as a compensatory mechanism. With less support from the collapsed medial arch, the foot may rely more heavily on the lateral side to maintain balance and stability while ascending stairs. These results highlight how flat feet alter normal gait patterns and help explain some of the discomfort and biomechanical issues associated with the condition. These findings have several important clinical implications. Since the data show that individuals with flat feet place more force on the lateral side of the foot, one clear approach is to focus on strengthening the medial longitudinal arch through physical therapy. Exercises that target the intrinsic foot muscles can help restore stability and reduce reliance on the lateral arch. Another strategy is use of custom orthotics. By providing additional support under the medial arch, orthotics can help redistribute pressure more evenly across the foot and improve overall gait mechanics. Finally, pressure mapping systems, like the one used in the study, could be integrated into rehabilitation programs. This would allow therapists to monitor changes in pressure patterns in real time and personalize treatment plans to each patient's unique needs. While this pilot study provides valuable insights, it does come with notable limitations. First, the sample size was small at just 2 participants, so these results are preliminary and not generalizable. Second, the FSRs are relatively low fidelity. Although they capture meaningful data, higher precision equipment could yield more detailed pressure mapping and reduce measurement variability. Looking ahead, future work should involve larger participant groups to strengthen statistical significance and improve applicability across different foot types. In addition, using more advanced technology, such as high-resolution pressure platforms or pedobarographic insoles, could help capture more nuanced force distributions. These upgrades, combined with a bigger sample size, would allow us to confirm whether the lateral pressure shift in flat feet is consistent across populations and help refine predictive models for clinical interventions. In summary, the study revealed that participants with flat feet experience higher pressure on the lateral midfoot and lower pressure on the medial side during stair climbing. Rather than confirming the initial hypothesis of increased medial loading, the data instead suggested a compensatory shift outward. This implies that individuals with flat feet adapt their pressure distribution, likely to improve stability when ascending stairs. Importantly, this pattern highlights the practical value of pressure mapping. By capturing these subtle force changes, clinicians can better tailor therapeutic interventions, whether through strengthening exercises, custom orthotics, or other strategies based on each individual's unique loading profile. In closing, this study shows a compensatory lateral pressure shift in flat feet, highlighting the importance of medial arch strengthening and the potential pressure mapping in therapy. I'd like to thank my Polygence mentor, Saad, and my family for their support. Thank you for your time and interest in my work.